there have been 45 cases of the measles across the U.S. as of Thursday. According to the CDC, that's still considered low. But health officials still say it's important to be vigilant. Local pediatrician Heather Long says measles can start out like any other respiratory virus, with a fever, cough, and congestion. She says what sets measles apart are the white spots that commonly appear in the mouth after infection.
It's mainly concerning just because of how infectious it is if you haven't been vaccinated against it.
45 measles cases have been reported in 17 states across the U.S. as of this week. Health leaders say this is alarming, considering the country saw 58 cases in total last year. 8 of the cases this year were reported in Clark and Wahkiakum counties in Washington state in January. Dr. Heather Long, a pediatrician at Clackamas and Oregon Pediatrics, says measles cases in the United States are still relatively rare, but
they've shown when vaccine rates drop below 95% of the population, that's when clusters of cases tend to pop up.
Measles has distinct symptoms that usually appear within the first few days of infection.
Spots can show up in the mouth. They're white usually, and then a rash on the outside of the skin will start usually around that same time. The rash starts on the head and the face and spreads down the body and is usually redder and more noticeable than other viral rashes.
If you see any of these symptoms, Dr. Long recommends contacting your medical provider for a screening.
About 1 in 5 children with measles will end up getting hospitalized.
Dr. Long says the vaccination against measles is largely effective.
If your child has been vaccinated, concern for measles, even with rising cases in the U.S., something to keep in the back of your mind, but not something to be too worried about.
Now, if your child is not vaccinated against measles, Dr. Long says there is a 90% chance of infection if they come in contact with someone with measles. She says measles droplets from a cough or sneeze can stay in an enclosed space for up to 2 hours. John, back to you.